Hi guys, good afternoon. The topic for today is menopause. We have spoken enough about the young women problems and the pregnancy issues. Of course, many more are than that. But a topic which people have asked me to speak on for their mothers, for their grandmothers, their aunts is menopause. What is menopause? A woman undergoes a certain change in her menstrual cycles. In cycles get spaced apart, they get reduced in flow. She feels it's not regular. So this is something that happens over a phase of 6 to 8 months. This phase is called as the climacteric. The climacteric period ends into established menopause. This occurs somewhere between the age of 45 to 50. This is the average age for any woman to get menopause. Now, what exactly does menopause do to a woman? Now, there are so many changes. The distinct ones are she gets emotionally little imbalanced. She feels not in control of her emotion. She feels that she can be hurt easily. She feels sensitive. She feels a lot of anxiety at times. There's something called as hot flashes. Now, what are hot flashes? A woman experiences something called as hot flashes. Hot flashes where she feels extremely warm despite there being an air conditioner or a fan on. She feels exceptionally dry in the urinary and vaginal area. She feels a constant pain of her muscles and bones. Now, the very common and a very serious condition is osteoporosis. As the levels of estrogen decline in a woman, the female sex hormone, a woman experiences symptoms of something called as joint pain, hip pain. She experiences a lot of pain in her back, in her sides of her pelvis. Now, there are two areas which are very prone to getting weakened and even fractures in her woman's 50s or 60s, which is the hip joint, the neck of the femur, the thigh bone, and second is the back. Now, very often we notice in our households, in our community, societies, you see a woman walking with a hump, a hunch. So the spine is very sensitive to low calcium deposits and osteoporosis. The bone gets weaker, gets spongy. The internal of the bone is not having a lot of calcium. So this is what happens to women with low calcium intake. And it's not that the woman has always been low calcium. Because of the menopausal changes, this happens. So the idea is right from her 40s, even her 30s if she wants, a regular tablet of calcium, some good milk products, dairy products in limitations as far as her diet pertains, and a lot of importance given to exercise, exposure to sunlight. This is one aspect of osteoporosis. The other symptoms of menopause require regular checkups. You require to see your gynecologist. You require to be counseled. You require a patient hearing. Yes, that's the most important thing. A woman needs to be heard out. She requires tender love and care. Her family, her children, her daughter, her husband, they need to understand that a woman is undergoing what all at this age as far as her health. She's not the same age she was when she was in her 20s and 30s. She's definitely undergoing a lot of changes. So a lot of support, a lot of emotional support, moral support would help a long way to go. And regular checkups for your uterine lining, a good checkup of your gynec history, a breast examination, history of family complaints in the past, things like that would help ease off problems. And prevention is better than cure. And menopause is all about regular checkups, counseling, and tender love and care. Thank you.